Okay, so we're going to go ahead and talk about hepatitis. It's chapter 31 in your Williams and Hooper book. You can also find a little bit about your hepatitis in your ATI Adult Med Surg book, not your fundamentals that we're using for fundamentals, but this will be in your Adult Med Surg ATI module book. Okay, so just talking about hepatitis in general, it's just inflammation of the cells of the liver. Hepatito means liver, itis means inflammation. So it can be caused by lots of different types of things. It can be a bacterial infection that invades the liver. It could be some kind of chemicals such as drugs, alcohol, any other type of chemical that we're using. And you think about, when I say drugs, you're always thinking about maybe the illegal kind, but this can also be drugs that just affect the liver. Remember talking about TB, and a lot of those medications are hepatotoxic. So drugs can also cause a problem with your liver. So a lot of times if you're taking certain drugs, we have to do liver studies just to make sure that the liver is functioning properly. So it can be a metabolic disorder. It can also be a vascular disorder. So possibly you're not able to get the blood flow there for whatever reason. But it typically is caused by a virus. There's different types of hepatitis. So there's A through E, and I do want you to know these, and you will need to know how it's transmitted. So hepatitis A is the fecal oral route. So somehow the fecal is getting into the mouth and there's some type of ingestion. So it's usually from some kind of contaminated food, or water, especially like shellfish that has the stool in like the shrimp and stuff, or any type of contact with infected stool. Hepatitis B is blood and body fluids. So you're going to get this one from unprotected sex, infants born to infected mothers, you have contact with infected blood, substance disorders, IV drug abuse, sharing needles, anything like that. Hepatitis C, blood and body fluids, same thing as hepatitis B, can be the same kinds of stuff. So looking at, organ transplants, contaminated needle sticks, this could be unsanitary tattoo equipment, people that are getting tattoos in parlors that may not be use the correct sanitation procedures. Hepatitis D, it's usually a co-infection with hepatitis B, so they will usually have both of those, and those are just some of the ways that you can get it, but it's going to be blood and body fluids. Hepatitis E is going to be fecal oral route, so that's going to be ingestion of any type of food or water contaminated with fecal waste, anything like that. So you think about how you could get contamination with like that. Well, I'm not going to do that, but if you go swimming in a lake, you go swimming in a pond, you go swimming someplace where there could be fecal matter, and you put that in your mouth and you spit the water out just playing, that is one of the ways that it can be spread. Okay, so hepatitis prevention. How do we prevent hepatitis? Number one thing, we talked about standard precautions. So using standard precautions, which is our tier 1 in our isolation precautions. So these patients are not in isolation, but we're using continuous standard precautions with all patients, treating them all as if they were infected. If they have something that would be draining or something obvious, we may put them in contact precautions, which that would go to your tier 2, and that would include everything in tier 1, and it would include contact precautions. So that's going to be your gloves and gown. Hand hygiene is our number one prevention. Vaccines, we do have a Hep A vaccine and we have a Hep B vaccine. Both of these are going to give you permanent active immunity. So once you get both of the series, hepatitis A I think is a series of 2, hepatitis B is a series of 3, they should give you permanent active immunity. However, sometimes the immunity can wax and wane and they can draw titers to see where you are, and you might have to have a booster, but they should give you permanent active immunity. Immunoglobulins, if you get exposed to one of the hepatitis and you've been exposure, sometimes we can give you specific immunoglobulins, and we take those from a plasma donor. So we take the blood and we kind of take the plasma out of it, and there's immunoglobulins inside that plasma, and we can give them those immunoglobulins, and a lot of times that's good for 3 months to help prevent maybe that infection from occurring. Sometimes we'll do that if a baby is born to a mom that has hepatitis B. We will give that baby some immunoglobulins to try to fight off that infection. Okay, so what kind of signs and symptoms are we going to see? So we're going to see a couple different things. Remember the prodromal stages of illness. So as far as hepatitis, the first thing you're going to get is like flu-like symptoms. Fever, chills, headache, those type of things. You might have some right upper quadrant pain. And then you're going to get into the icteric stage. Icteric just means you're going to become jaundice, and those symptoms are going to become much, 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 much worse. This is going to last anywhere from 2 to 6 weeks. And then you're going to go into your convalescent period, which is going to last anywhere from 2 to 6 weeks also. And that is that convalescent period where you're still not going to feel good. You're going to be fatigued. You're probably going to be able to return to work, but you're still going to be tired. And that is just when the liver enzymes are returning to normal. Okay, so what kind of complications do we see with hepatitis? Well, one is chronic hepatitis. If you have chronic hepatitis, it's just ongoing inflammation of those liver cells. So they're constantly irritated all the time. This can lead to cirrhosis, which we're really not going to discuss in this particular portion. You will get that in your adult med surg. But if we continue to have chronic hepatitis, that can lead to cirrhosis, which is severe scarring of your liver, which then causes lots of other problems, because if you look at what your liver does, it has multiple functions. So if those functions can't be carried out, you can see that there's going to be a lot of complications to individuals. So the chronic hepatitis usually is from hepatitis B, C, or D, and having that chronic hepatitis does increase their risk for some liver cancer. Acute liver failure. We don't see acute liver failure very often, but if we do, it's usually rare and usually from some type of overdose, a Tylenol overdose or some type of medication that affects the liver. But it's severe, potentially fatal form of your kind of like your viral hepatitis. It can be a viral, it can be acute, it can be a drug overdose. So symptoms develop like a viral hepatitis, but within hours we go into liver failure. There's really no medications to treat it, so we provide supportive care. And what we mean by supportive care is we maintain your blood pressure, we maintain your pulse, we maintain your airway, we maintain, what we can maintain, but there's no medications to reverse this or change it. So once those damage has been done to your liver cells, it's going to be a permanent damage. So that liver may or may not be able to meet the demands of your body. And we can do liver transplants, but there's a list and there's a whole lot of things that go into that. And these people may not live long enough to get to that liver transplant. So that's your acute liver failure. It can be like a severe viral infection, or it can be like an overdose that has, compromised the liver. And then cirrhosis. That's just your scarring that we talked about a minute ago that usually happens from your chronic hepatitis. And then if that chronic hepatitis doesn't get resolved and goes into cirrhosis, then that increases our risk factors for liver cancer. Hepatic encephalopathy. This is a life-threatening condition when your liver fails. When your liver fails, your liver detoxifies everything. It breaks down our protein. So when our protein that our body makes, our liver helps make protein too, but it also gets rid of all the byproducts of our metabolism. One of the byproducts is ammonia. And so ammonia is usually broken down by the liver and made and put into urea. And that urea is sent to the kidneys to be excreted. Well, if our body can't do that, then that ammonia stays in our body and goes to our brain and causes us to have this encephalopathy. And many of these patients are going to develop a lot of neurological changes from this pneumonia, confusion, gait changes, cognitive changes, all of those types of things with your hepatic encephalopathy. So sometimes we will see this hepatic encephalopathy with somebody that comes in acute alcohol, like somebody that's an alcoholic that comes in and and they've went into liver failure. Okay, so how do we diagnose hepatitis? Well, pretty much by serum tests. So we're going to draw blood. We're going to do liver enzymes, and those liver enzymes is alkaline phosphatase and alkaline transaminase. They're ALP and ALTs, so you're going to look at your liver function. So when you get to clinical, start kind of looking at those and seeing what's elevated, and then go back and look at their history and see what you see. Is it medications? Do they have a history of hepatitis? Serum bilirubin, because remember, our liver, when our red blood cells get broken down, they break down in the liver And the byproduct of that red blood cell breakdown is bilirubin. So if the liver can't break them down anymore, it cannot excrete that bilirubin anymore, that bilirubin level is going to get elevated. So we're going to have an elevated bilirubin level. Our liver also helps make clotting factors. So if our liver can't work, it can't clot. So therefore our prothrombin time and prothrombin is going to be affected. So we're going to do a prothrombin time to see how quickly our blood clots. And that's something that we would want to look at. A lot of times our people that have chronic inflammation or that chronic hepatitis, before they can have any types of surgeries or anything, they have to have all these clotting studies done to make sure that they're going to be able to clot after surgery. So lots of serological testing, and we can do a liver biopsy. The liver biopsy is the most definitive, and it identifies how intense the infection or the degree of liver damage is. A lot of the testing doesn't tell us how bad it is or how much damage is in our liver. But if we do the biopsy, that will give us that indicator. Oops, sorry. Okay. Okay, so how do we treat hepatitis? Well, there's a lot of therapeutic interventions, but the first thing that we need to think about is, what is the cause? Is it medication? Is it alcohol? Is it a virus? Is it a bacteria? What is it? And then we need to look at their liver functions. Keep their liver functions the best that we can, relieve as many symptoms as we can, so we might be giving them pain medications, we might be giving them some supportive care, increasing fluids, they might have IVs, and we're just trying to prevent that chronic hepatitis from going into cirrhosis. So we want to make sure that they're eating appropriately, make sure they're getting plenty of protein, because remember, protein is the building block to making healthy tissue. So we have to have enough protein to build our tissue back. So we're going to talk to them about hydration and nutrition, make sure that they're resting, avoid any kind of alcohol or liver toxic drugs. So specific therapeutic interventions that we're going to do for hepatitis A, it's supportive care. We can give a vaccine post-exposure to maybe protect them against getting hepatitis B if we know that they've been in contact. We can also give them some immunoglobulins if we know they've been exposed, and we can hope that prevent that from happening. Hepatitis B, there is no medications to treat hepatitis B, so it's going to be supportive care. We can give them some antivirals, and these antivirals can help some. We can give them some like pegylated interferon therapy, which interferon therapy is basically, we have interferons in our body, and these interferons are produced by our cells of our body to help fight infections. So what we can do is give them the extra interferons to make our body produce more infection fighting stuff to help fight those kinds of things. Hepatitis C, there's certain medications. Hepatitis C used to be the only treatment that we had was a liver transplant. Now there is a medication called Harvoni, and Harvoni, I would probably know it by the generic name, which is going to be sofosbuvir, and that's, I like Harvoni better, it's a lot easier to pronounce, but that's actually treating our hepatitis C, but it's very, very, very expensive. It's about $10,000 a month, depending on what insurances will pay and if they decide that it's, experimental or not. We can also do interferon with our hepatitis C's, and again, that is just substances that we put in to try to help our cells fight that infection better. Hepatitis E, there's really no medication for that. Okay, so what are we going to do as nurses? Most of these patients are going to be cared for at home. The initial acute will be at the hospital, maybe diagnosis will be at the hospital, but then they're going to be cared for at home. So we want to make sure we teach these patients they need high carbohydrates because they need lots of quick energy. They're going to need high calorie because their bodies need a lot of things. Their metabolism is going to be very increased to fight off all this infection. They're going to need some protein. We want a moderate amount of protein, and we want to make sure we give them small, frequent meals. So we want to make sure we promote that hepatic rest so our liver cells can regenerate. Our liver does have the ability to regenerate cells. Not all parts of our body have that ability to regenerate, but the liver does have the ability to kind of regenerate some new cells. Not totally, but it can do it. So we're pretty much going to administer only medicines that are absolutely necessary, because almost everything gets detoxified in the liver, so we don't want to stress the liver, so we're going to really try to work on not giving them medications. Avoid alcohol at all costs, and make sure we limit that activity to allow their bodies to heal. So we want to make sure we teach them about how transmission can occur, so we don't want to give it to anybody else in their family. So avoid any type of sexual intercourse until the hepatitis antibody testing is negative. So they will have to go periodically to get antibody testing, because once they get it, remember what we talked about, when we get an antigen that comes in our body, we produce an antibody against it. So they have to make sure that they have to go have antibody testing and make sure that it turns negative. Use proper hand washing. Avoid sharing any household items. So this is blood and body fluids, so they wouldn't want to use the same razors. I wouldn't use the same wash rags and towels and things like that. I would put everything through the dishwasher on a hot cycle. So I would just make sure that we're not sharing anything that could have blood or body products on it, and just be aware of teaching those types of things. Okay, that is hepatitis.